why are children, now that we understand how the infection takes place, we will be able to understand why children are seeing less infections and less severe
all
infections.
All of you to the first speaker. The first speaker for today is Dr. Deepa Isho. Dr. Deepa Isho is a pediatrician by profession, and she has
everything about COVID-19. But the problem is, for an oncologist, we have a double burden. We have to balance cancer on one side and COVID-19 on the other side.
Tantrums, parents should understand that this is a temporary phase and stress is manifested like that. Some children.
all of you. I am Swapnesh Sebastian, business consultant and trainer. Dr. Preeti Gopinath, who's joining us from Pune. Dr. Preeti is the associate professor, and I provide training to
self. It is self-harm. If it is turned to others, it can be violence. Domestic violence increased, breakups were more, and divorce rates, we are yet to get it. Definitely it is going to be high.
Not been proven is through breast milk. So that is the reason why we ask mothers to continue to breastfeed their babies, because
So, first of all, Doctor, thank you so much for joining us, taking this opportunity to come and address us during a time where we have so much work in the hospitals, especially in the south of India. And also the fact.
And pregnancy, there was more because they were so anxious about the child. Even we do not know we have to say
COVID-19 in children, thankfully, has not caused such a severe disease as it has in adults. The reasons being,
if you want to readjust your mask, you have to first sanitize your hand, then only you have to touch the mask. Otherwise,
It comes from a state which has a lot of positive initiatives.
Wait and see what are the complications.
To cancer patient may increase the risk of severe infection.
in a protective environment now. Right from the start of this pandemic, everything has been under lockdown. Children are not going to schools, and so they are not being exposed to the virus. So that definitely does have a protective effect. So we will only know the full
The focus has come back, Dr. Aravind, and the question
COVID can cause for children.
is,
Cancer patients, that's a good question, Sapnesh. See, after the treatment for breast cancer, those patients who are hormone positive,
At least 30 minutes for themselves and do whatever they want. They have to tell the family, I have to take care of my mental health.
number of children are being affected, and even the children who are cold or a cough.
considering tomorrow's Independence Day, I'd like to wish everybody a happy Independence Day. Indian Standard Time and 2:30 p.m. GMT, and here we are at the Intricate Conversations with Swaps episode 3. So welcome you all to this third episode, and glad to meet all of you. I'm Swapnesh Sebastian, business consultant and trainer, and I provide training to multinational companies across India and smaller companies. To know more about my profile, you can click on the link that's been shared on the chat window. So thank you so much for this wonderful day. It's a week where we've had some sad news in the family, and we've had a death. My cousin of just 44 years passed away this week, and I'm sure that this brings us to the focus of the importance of health and healthcare systems. And sometimes I think we kind of underestimate the fact that we can just breathe, walk, do our things on our own, and it's taken for granted. But I suppose this pandemic has brought us to a point where we've realized that being healthy, being able to do our things by ourselves is so very important and so very crucial for us as a humankind. Now, as I spoke about healthcare, I think this is a situation where the focus has come back to healthcare, the healthcare as well as the healthcare system. And the system is about having so many people working together to help us be healthy during this time of the pandemic, as well as in general, right? So the healthcare system has so many people around from doctors to nurses to paramedics to pharmacists to lab technicians to ambulance drivers to cleaners, ward boys, just to name a few. Yeah. So there are so many more contributing for our good health and working even during this time to keep us hale and healthy. So thank you so much for coming in and joining in today. It's a pleasure to have three people from the healthcare system to represent this healthcare system and share their thoughts. We have Dr. Deepa Isho, who's going to be our speaker one, and will be giving us a perspective of pediatrics during COVID. We have our second speaker, Dr. Aravind Anand, joining us from Trivandrum. He's going to speak to us about cancer care during COVID. And we have our third speaker joining us from Pune, Dr. Preeti Gopinath, who's going to give us the crucial aspect of mental health during COVID, right? So thank you so much once again, speakers, for joining us in the midst of your busy schedule. And we know that you have taken time out of your real work hours and academic commitments to come here and join us. So thank you so much once again. And I hope that this would be a great session where a lot of people can get some of their clarifications sorted out and get more clarity in terms of health from the three perspectives. Since we have a lot of webinars going on the general COVID, this one's going to be focused on these three specialities, and our doctors will try and stick as much as possible to these three specialities and COVID related to these three specialities. So this is something that we like to start up with. Our format is going to be, we're going to have each speaker speak for about 10 to 15 minutes, and then you can post the question if you would like for that speaker, post the speaker's presentation. Then we'll move to the second speaker, and then we'll move to the third speaker, and post that we'll try and have a short Q&A where we can have our questions answered as much as possible. So I hope everyone is doing healthy, is doing well and healthy right now. And I hope that this will help us get a better understanding of healthcare and the value of health. So without any further delay, let me introduce all of you to the first speaker. The first speaker for today is Dr. Deepa Isho. Dr. Deepa Isho is a pediatrician by profession, and she has over 16 years of experience working in the field of child health and care. So she has treated patients or kids from the age of 2 months to about 18 years. And she works as a private consultant with a couple of famous hospitals in Chennai. It's a pleasure to have you, doctor, on the show. And we hope to get started with the first speaker. Thank you so much for joining us, doctor.
Begin by first offering my deepest condolences to the tragic passing of your cousin. Good evening. COVID-19 in children, thankfully, has not caused such a severe disease as it has in adults. The reasons being postulated are multiple. Some of the reasons I will be covering later on in my talk. But before that, let me just give you a few important points about the coronavirus and how this coronavirus attacks a human being and why is it so infectious. So coronavirus, the group of coronaviruses are not new, anything new. They've been around for a long time. They cause a spectrum of diseases from the common cold to the most severe COVID-19. There have been epidemics of coronavirus infections in the past, even the Nipah and the Ebola viruses. And these are usually transmitted from animal reservoirs to human beings. And they tend to cause very severe infection in human beings. So this is what happens, when we start destroying animal habitats, like we destroy forests and we destroy their habitat, they start moving towards human beings, and where human beings are staying. And there the risk of transmission of an infection from the animal to the human being is always there. And that is the reason why this concept of One Health, where the health of the animal kingdom, the plant kingdom, and humans are all integrated. And unless we take care of each one separately, we are going to keep having conditions like this where infectious viruses from animals are transported to human beings. Now, how does coronavirus tend to affect a human being? The main mode of transmission is through droplet infection. So a person coughs, a person who is infected coughs or sneezes or even talks there is a spray of virus, and that virus tends to affect another person who is standing close by. And the reason why it is so infectious is many asymptomatic people with no symptoms, who do not even know that they are infected, are also carrying a bit of the virus, and therefore they can transmit the virus even before they have symptoms. So that is the reason why it is extremely difficult to control it. The other methods of transmission of this virus is by touching a contaminated surface. For example, a person sneezes or coughs and the table has got a whole load of the virus. Another person comes and touches that, and then touches their face, touches their nose, their eyes, and their mouth. So again, there is a transmission. So that is the other mode of transmission of the virus. Fecal-oral transmission, that means they have found that children who are affected with COVID, there is a large amount of virus in their stool, in their motion. So if proper hand washing techniques are not employed, touching that, and then again that can be transmitted. So that is the other mode of transmission. But the main mode of transmission is through droplet infection, and that is the reason why masking is extremely important. Now, two questions that most people have to pediatricians is, how about vertical transmission? Does a pregnant mother transmit the infection to her fetus or to her baby? Now, that is something that has not been proven, but of course, it is a very early in the pandemic and in the disease process for us to authoritatively say that it is not possible. But so far, most studies have found that it is not the transmission is not happening like that. The other way by which transmission has not been proven is through breast milk. So that is the reason why we ask mothers to continue to breastfeed their babies, because breast milk is not known to transmit the illness. But mothers, when they are breastfeeding, a COVID positive mother, when they are feeding their baby, must definitely take precautions such as hand washing, wearing a mask, and then feeding the baby. Or if they're not up to it, then definitely they can express the milk, and another person, a healthy person in the house, can feed the baby. So this is about transmission of the virus. Now, what happens when this virus enters the body? Now, this virus tends to latch on. It's a very sticky virus because it's got something known as spikes on its surface. That's why it's known as corona, the crown. So it's got like spikes, and these spikes are extremely sticky. They come and stick to certain receptors in the human body, and these receptors are seen everywhere in the airways. So it is seen in the nose, and it is even seen, interestingly, in the tongue. And that is the reason why many people who are affected with COVID are found to lose their taste and their sense of smell, because these receptors are there in the nose as well as in the mouth. They are there in the airways, in the lungs, in the gastrointestinal tract. So these, like a lock fits a key, these viruses come and latch on to these ACE2 receptors. They are known as ACE2 receptors. They come and latch on to that, and then they start using the genetic material of the host cell to start multiplying. So during this period, the patient may not have any symptoms at all, but still can have a viral load by which the patient can transmit the virus to other people. Now, once it enters the body, it usually goes to the lungs and it causes COVID pneumonia, and then the patient starts having problem. So usually this whole thing takes place within 2 weeks. Some patients go into a third stage after about 2 weeks, known as a hyperimmune stage, where their body starts reacting very violently to the virus, and there is a whole cascade of events which leads to damage of a lot of the organs, and that is when they become critically ill. So this is how the whole infection takes place. Now, why are children, now that we understand how the infection takes place, we will be able to understand why children are seeing less infections and less severe infections. Most children, less number of children are being affected, and even the children who are affected are having less severe symptoms. Now, why is it that? One is because these ACE2 receptors are less in number in children. So this virus does not have too many receptors to go and latch on. So that is one reason that is being postulated. The other reason that is being said is children, of course, are in a protective environment now. Right from the start of this pandemic, everything has been under lockdown. Children are not going to schools, and so they are not being exposed to the virus. So that definitely does have a protective effect. So we will only know the full magnitude of the infection once things open up, children are exposed to the virus, and we will have to see how they do. So the other reason are children usually have healthy lungs. None of them are smokers. So there is no way that smoke is going to affect and damage their lungs. So they are able to handle the COVID pneumonia and all that in a better way. The other thing is most children do tend to have viruses in their bodies. Most of them are having a cold or a cough. And so these viruses tend to compete with the coronavirus. And as a result, the coronavirus is unable to thrive in the bodies of these children. Of course, certain vaccines such as BCG and measles are being postulated to have some amount of protective effect, but these are too early to kind of say that they definitely do have a protective effect. Now, how do the symptoms appear in children? Just as in adults, children also tend to have a fever, but most of them are having low-grade fever. They can have a cough, they can have a cold, but the important thing is we are finding children having just fever with loose stools. So that is something that parents should be aware of, that a child presenting in this season with fever and a loose stool should not be taken lightly, and definitely a consultation with a pediatrician should be done. Now, some children tend to have more severe infections. Now, which are these children? These are children who are either obese or children with other comorbidities, such as they have a renal problem, a problem with their kidneys, with their hearts, with their lungs, or they are on cancer treatment, or they are on steroids for some other condition. So these children tend to have a more serious infection that is known as multisystem inflammatory condition. And in that condition, children can present with a fever, with a rash, with involvement of multiple organ systems. But thankfully, we are finding a very small number of children getting so sick with that kind of a condition. Most children are recovering without much problem. Now, what do we do if a child starts developing these symptoms during the season? If a child definitely, there is a history of definite contact with a COVID positive adult, then it is good to get the child tested so that we know whether the child is COVID positive. Otherwise, if the child is just having a symptom, nobody else in the house is affected, it is good to have at least a teleconsultation or a video consultation with your primary pediatrician, so that they will be able to help you to identify whether this is just the ordinary flu or whether this is suspicious of COVID or any other condition. Now, usually there is no particular drug that can be given to cure COVID. Most of it is only supportive treatment. So we treat the fever with paracetamol. We ask the parents to give a nutritious diet, plenty of fluids, and monitor the child. So if the child is becoming lethargic, tired, not taking in orally, then we ask them to immediately bring the child to the hospital. The other thing that needs to be monitored is the oxygen saturation. So for that, nowadays pulse oximeters are available all over the market. Most people are aware of that, and that is something that can be used to measure the oxygen saturation, and I'm sure the primary pediatricians will be able to help you with that. Now, if there is a COVID positive person in the house, what precautions should you take? The most important thing is masks should be given to the people who are COVID positive. Even if it's a child, we say any child above the age of 2 years must be masked. So it is a good thing to start getting your children used to wearing a mask now itself, instead of suddenly doing it to them when they are sick or someone in the house is sick. So try to make it like a game. Try to and all of you wear a mask and play a game, or put a favorite cartoon character on the mask so that the child's fear of the mask goes, or put a mask for the child's favorite doll and say, see, your doll is wearing it. So once the child starts getting used to wearing a mask in the house, the child will not fear wearing a mask, and the child will realize that this is not something that I need to be scared of, and this is not going to suffocate me. The other important thing is definitely hand washing. So the child should be taught how to do hand washing, and of course we say 20-second hand washing. Now it's very difficult to tell a child you wash your hands for 20 seconds. So an easier way to do it is ask the child to sing happy birthday twice. So usually that comes up to 20 seconds, and that child will be very happy to do that, and usually the hands will get clean. So just plain soap and water is what we are advising with children. Alcohol sanitizers are being advised, but not very safe in children, because we are finding a lot of cases of alcohol sanitizer poisoning these days, because children seem to be fascinated by it because it comes in all different kinds of colors like blue and pink. So they think that this is something for them to drink. So it is not very good to use alcohol sanitizers on children. Plain soap and water will be the best. And of course, try to keep the child away from elderly people in the house. They definitely should not go near their grandpa or their grandma, and that can be told to them in a very affectionate way, and I'm sure children will tend to understand. Now, how do you clean the area that they are using. Washing clothes should be done with warm water or hot water. Cleaning definitely should be done with anything, like bleach or even sodium hypochlorite. Vegetables and fruits that are bought can be cleaned with just cooking soda. You put a drop of that in water and you soak it. That will be good. Any object that is brought from outside, it is good not to allow children to go and touch it immediately. So it is good to keep it or outside for a couple of hours, or at least clean it with some kind of a sanitizer, and only then allow the child to touch it. The important other thing is, when you are cleaning the bed sheets, or making the bed of a COVID positive patient, it is good. You must remember that you should not take it and dust it, because what happens is there can be an aerosol generation there, which can cause spread of the illness. Similarly, a COVID positive person uses a restroom or toilet. When they flush the toilet, it should be done after closing the toilet seat, so that you're not generating aerosols there. Ideally, it is better that they use a separate toilet if that is a possibility. So these are some of the things that can be done for prevention of the illness. So other than that, children should not be going out unless and until it is an absolute necessity. And as I said, children above the age of 2 years should wear a mask when they go out, should maintain social distancing at least 6 feet. You understand why I said that? Because these are droplets. Droplets, they claim, are not going to travel beyond a 6 feet distance. And if you are keeping a distance of 6 feet, what happens is it tends to fall to the ground and it doesn't reach you. One important point that I would like to make during this lockdown is the mental health of children. I'm sure one of the speakers who's going to deal with mental health is going to deal with it in more detail. But I would like to tell you that children should have a structured routine to their day. They should not be allowed to just get up when they want, go to sleep when they want, use screen time when they want. That should not be the case, because that affects their overall well-being, and it will get very difficult when they have to go back to their routine. So children should be made to get up at a particular time in the morning. They should have structured timetable to do their lessons. They should have playtime, and definitely children should be allowed to have at least a video call with their friends. Especially young children, adolescents, they tend to open up a lot more with their friends than with their parents. So they should be given the facility to do a video call with their close friends and spend time with them, at least through the media. So that is extremely important. And sleep time, 1 hour before sleep time, all screens should be closed. They should not be allowed, and they should go to sleep at the right time every night. You give a little bit of flexibility over the weekends, when they can have a little bit more of a time to spend, watching a movie or something like that. But during weekdays, they should have a structured routine to their whole day, which tends to help in their overall well-being. And one more thing that I would like to emphasize is vaccinations. So many people, I find, are very, very scared to bring their children to hospitals to get their vaccines done, their routine vaccines, which can be extremely dangerous, because we do not want an outbreak of vaccine preventable diseases during this pandemic, when already healthcare workers are being overburdened. So because of that, children should be taken for their vaccinations, especially the primary series less than 1 year. So I'm sure most pediatricians have got protocols in place to have safe vaccination practices. So I'm sure you can contact your pediatrician and it should be done. Thank you.
Thank you, Doctor. Dr. Deepa has a very good combination of teaching and private practice as well. So thank you so much, Doctor, for addressing one of the top fears that a lot of people have had during the COVID, about children getting COVID. So audience, if you have any questions, feel free to post any questions to Dr. Deepa, the pediatrician, on the chat window, and we'll try to address some of them at the end. Now moving on to the second concern, another concern which is about having family members or friends who are affected by cancer. So some statistics from the US say that about 450 people among 100,000 are actually affected by cancer in the US. They say about 8% of the population below the age of 75 likely to be affected by cancer in the coming years. And to speak to us on this topic and to give us some light on this topic, we have Dr. Aravind S. Anand joining us from Trivandrum. Dr. Aravind S. Anand is the additional professor and unit chief of the Department of Radiotherapy and Oncology at the Government Medical College, Trivandrum. Dr. Aravind has a very impressive profile and he has a fellowship in conformal radiotherapy. His areas of interest are breast cancer and lung cancer. He has published more than 10 papers locally and internationally, and he's here to help us with the understanding of treatment of cancer and cancer-related patients during the time of COVID. So first of all, doctor, thank you so much for joining us, taking this opportunity to come and address us during a time where we have so much work in the hospitals, especially in one of the government hospitals, where it's really busy, one of the busiest hospitals in the south of India. And also the fact that he comes from a state which has a lot of positive initiatives to deal with cancer as well, like Kerala can and so on. So thank you, doctor, for joining us. And I will hand over the session to him to give us some insight into treatment of patients and treatments available during the COVID times in the aspect of cancer.
Okay. Thank you, Sabnesh. Nice introduction. Good evening, all of you, and a big hi. Our media is a lot about COVID-19, and you are aware of everything about COVID-19. But the problem is for an oncologist, cancer patient, we have a double burden. We have to balance cancer on one side and COVID-19 on the other side. So today, let us discuss how we can. Let me give you an overview of COVID-19. Dr. Deepa has very beautifully given everything about COVID-19. As you all know, COVID-19 is caused by coronavirus, which has a spectrum of presentation. It starts from, it can be a mild disease. Majority, 8% may not have any symptoms, just mild fever, cough, loss of smell, taste, nasal block, headache, and diarrhea. So 80% comes under this category. Severe disease, only 15% may have high fever, shortness of breath due to pneumonia, and they may have severe cough. Basically, the cough is dry cough. And some patient may become critical. Only 5% may go for the critical stage, maybe the acute respiratory distress syndrome or the respiratory failure. The patient may go for multi-organ damage, and they may go for septicemia or septicemic shock. The mortality rate of COVID-19 in the adult is roughly less than 2%. So let me show you this image. I show three images here. The first image is an X-ray of a patient, and this is an early stage of COVID. So you can see the on the left and the right side, the black color means that means it is an aerated lung, means there is air in the lung. Okay, so this is actually the COVID has not affected the lung very much. Okay, so I am just discussing very slowly because I think majority of my audience are non-medical people. I just want to tell you what pneumonia is. So in the second X-ray, you can see that on the right side here there is opacity, means that means white color here. That means there is the consolidation. We tell that the lungs has become solidified, so it is unable to expand. So that is called pneumonia. So the main reason for the mortality is the ARDS, what is the pneumonia. The second, third is image which I have shown is a CT image where you can see the same picture, the white area, the periphery showing consolidation or pneumonia. Okay. Now, COVID forms a high-risk group. The high-risk group is a cancer patient, chronic kidney disease, COPD patient, the chronic obstructive pulmonary disease like the asthmatic patient, immunocompromised state means the HIV patient or the post-transplant patient, then obesity, serious heart disease. Just no doubt it's a serious heart disease, and uncontrolled diabetes mellitus, because we may 30% of our patients, our population have diabetes. So hence, it's only uncontrolled diabetes and sickle cell disease. So our area of interest is cancer. Why cancer is at a high risk? See, there are multiple reasons for that. The first thing is that there is increased risk of acquiring COVID-19 infection. The chance of contracting COVID is on the highest side because majority are immunocompromised. The second is, once it is infected, the severity of COVID-19 is high in cancer. The cause or the sequelae will be high. And the third reason is chemotherapy, which is given to cancer patients, may increase the risk of severe infection. Cancer patients, during the time of treatment or even after follow-up, they have frequent hospital visits for cancer treatment. So they may be put at risk of COVID-19. So that's why cancer is at a high risk. Now, let me give some tips for the cancer patient. See, we hear a lot that we have to wear a face mask when you go out. But unfortunately, when I just travel or when I sit in my clinics, I see that 60 to 70% of the people are not wearing masks. You have to wear the mask covering your nose and your face. Some people put in the chin area. They won't cover the nose. So rather than telling you wear mask, I just request you to wear it properly. The second thing, wash your hands with soap or sanitizer for at least 20 seconds. And the third thing we have observed is that people will take their hands to just readjust the mask, and this is not a good thing. If you want to readjust your mask, you have to first sanitize your hand, then only you have to touch the mask. Otherwise, you should not touch your face or nose or eyes unnecessarily. Avoid crowded places. Avoid contact with friends and relatives who have symptoms of COVID-19 or living in endemic zone, and guarantee social distancing. That is important, or 6 feet is important. Okay. Now, what are the other tips which I can give you? Avoid shaking of hands or hugging, and you can find a sanitizing soap in your home where you can remove your clothes and shoes before entering, after traveling from, after coming from your office or some other places. Eat well and have good sleep. Drink plenty of water. So hydration is very important. Eat good food high in protein like eggs, soya, peas, and that should be clean vegetables and fruits. Exercise regularly, regular exercise, moderate exercise, that is important. Avoid tobacco. So these are some of the general things which I can tell you, and cancer patients should be very specific to this. Now, which category of cancer patients have the highest risk? So just note down, patients on chemotherapy, during chemotherapy period, or they have received chemotherapy in the last 3 months. Patients who have receiving extensive radiotherapy, means a protracted schedule of radiation treatment. Those patients who had a bone marrow transplant in the last 6 months, or they are on any immunosuppressive therapy after their bone marrow transplant. Leukemic patient, lymphoma patients, and myeloma, the lymphoreticular or the hematological malignancy, rather than the solid tumors. The patients on any immunotherapy or any antibody-based treatment for cancer. Some people may be on long-standing steroids. They are also at high risk of developing or contracting COVID-19. Now, you may ask whether is there any change in the diagnostic protocol or in the initiation of the treatment during this COVID-19. See, we oncologists, for the diagnosis, we advise a lot of procedures, but that is a part of the routine protocol. But during the COVID-19, we are able to skip some of the procedures and the test. We do only the highly essential one for starting the treatment and for the diagnosis. So your physician will definitely have special attention areas regarding testing of COVID, that is RT-PCR, prior to a cancer surgery, chemotherapy, or radiation treatment in all high-risk patients, which we are already mentioned, and all symptomatic patients. We have to do a RT-PCR COVID testing prior to the start of surgery or chemotherapy or radiotherapy. If a cancer patient on treatment develops any new symptoms like fever, a cough, or breathlessness, they must consult their doctor without delay because it is very difficult to differentiate whether it is due to the COVID infection or is it due to the cancer per se. Now, is there any change in cancer treatment strategy during the pandemic? Yes, little changes are there. First thing is, patients, if possible, they should discuss with their doctors, friends, or ladies to phone as possible. Rather than visiting the patients requiring surgery, radiation, or chemotherapy for curable disease continue with the treatment without postponing it if it is COVID negative. See, this is an area, a lot of calls I get from my patients just requesting to postpone their treatment or it's safe to postpone the treatment. For a curable malignancy, we will never advise you to postpone your treatment because you may lose the chance of cure from cancer. So we will balance it. So that is the risk and the benefit. So a curable disease, if you are COVID negative, you have to continue with your treatment. With regard to adjuvant chemotherapy, which have only minimal benefit, it is better to avoid. See, for example, a colon cancer in a very early stage, we may be giving some adjuvant means after the surgery, giving some chemotherapy, which have a minimal benefit. So then we will think whether minimal benefit should be taken care or whether you should think that the patient is getting exposed to COVID. So we'll balance it. So where the benefit is minimal, we may better avoid. So that means your physician, your oncologist will decide upon it. Now, next thing is that if you are giving chemotherapy not for a curative intent, just for a palliation, it's better to avoid or give a chemo holiday and then you can later on continue with this. Now, with regard to the radiation treatment, see, for example, the breast cancer, usually we may give 25 fractions with 25 days of treatment or 16 weeks of treatment. But now there can come down number of fractions of radiation treatment without compromising the efficacy of the treatment. We have evidence for that. So in this COVID period, we never want to do unless we repeatedly come again and again to the hospital so we can reduce the number of fractions of the radiation treatment. That's for that. Now, with regard to the chemotherapy, majority of the chemotherapies are given as intravenous chemotherapy, that is injection chemotherapy. Now, we have in some cases switch over to oral chemotherapeutic agents if because sometimes the efficacy may be the same. In some situations, we can switch over to oral chemotherapeutic agents. Now, some patients may be already be on after the completion of the treatment, they may be on some maintenance therapy. So these patients have to follow visit. So they can make a telephonic call or a web-based consultation with the oncologist and they can pick up therapy even without traveling their hospital. Another thing is that after the treatment of completion of the cancer treatment, the patient is advised to report at regular intervals for follow-up. That is a follow-up consultation, usually maybe between 3 to 4 months. But if if you can make a call to your doctor and tell that I don't have any symptoms, I'm perfectly all right, the doctor will definitely give you increase the time interval from 4 months. They can increase to another 2 more months, no problem. And they will come down with the frequency of the follow-up scans in this during this period. Okay. Now, suppose a cancer patient is infected with COVID-19. What will we do? So a patient is already on any anti-cancer treatment, for example, therapy, and he is getting diagnosed with COVID-19. Definitely they have to interrupt the cancer treatment. And cancer treatment can be restarted once the patient becomes asymptomatic and same time COVID-19 negative. You may ask me after how many days he can be restarted. But I cannot tell you exact the days because we don't have much evidence such as the time we need to start or restart and a cancer treatment after a COVID-19 infection. So it should be what is the purpose of giving this treatment? Is it a curative intent or just a palliative intent? So a lot of factors come there. So that is the addiction. Now, the next question is, what are the outcomes of COVID infection cancer patients? See, as we have evidence such as that, there is an increase in the mortality, that is, increase in the death rate if a cancer patient gets infected with COVID. We don't have much evidence to tell like that. The sequelae may be made very torturous, but the mortality may not be that high. But we have observed, we have evidence upon that. Advanced age with other comorbidity conditions there in a cancer patient infected with COVID-19, definitely there is an increase in the mortality. So, withholding an effective cancer treatment during the pandemic will increase the cancer morbidity and mortality. So, we should balance the treatment, which I have already mentioned. This shows is a couple from US, Texas. The wife had breast cancer diagnosed in February of 2020, and at the same time, she developed ovarian cancer. After the surgery, after 1 month, her husband developed COVID, and he was admitted. So this lady couldn't continue with the chemotherapy because she had to take care of cancer. So he got COVID negative, and then at the same time, this lady also became COVID positive. See the situation. But after lucky, and she completed her therapy, she completed her radiation treatment, and now she is free of COVID and at the same time free of cancer. So nothing is impossible. Patient, they have willpower, they might have improved their immunity. At the same time, they have followed all the protocols that have been done by the government and at the same time the treatment down. So, what's the take-home message? Follow the public health guidelines issued by health department to prevent infection. Skipping a treatment for cancer because of the concern about the risk of infection with COVID-19 is a serious decision. Thank you very much.
Thank you, doctor. That was a brilliant presentation with a lot of information on the slides. Very well done as well in terms of the content that we have. Thank you for addressing some of the fears, and I'm sure that it gives us some insight into dealing with cancer patients during COVID. Thank you so much, doctor. It was a pleasure having you. If you have any questions for Dr. Aravind, you can post it on the chat window, and we'll try and address a few post the third speaker. Now, before we get to the third speaker, shall we have a quick poll, audience? I think we'll try and have a quick poll to see if, please key in your inputs. We have 30 seconds to do that. Another 10 seconds and we will end the poll. 5. Admin, would you like to end the poll and post the result? Astonishing. About 54% of the people say that they have had an impact mentally or psychologically during the COVID. We go to the third speaker for today, and I think that's an introduction to our topic, to the third speaker. Our third speaker is Dr. Preeti Gopinath, who's joining us from Pune. Dr. Preeti is the Associate Professor in the Department of Psychiatry at the Dr. D.Y. Patel Medical College and Hospital. She has an MD in Psychiatry, and she has served 20 years in the Central Government Health Scheme. And since 2012, she has been teaching and practicing at the D.Y. Patel Hospital. So, Doctor, it is a pleasure having you on the show, and I will probably welcome you to the show with this question. I think we've had a lot of questions for the doctor, but I will start with one of these questions, Doctor. Welcome, first of all. The question is that a lot of people, Doctor, who are mentally stable, mentally strong, balanced people pre-COVID have been breaking down during this time. So what are the common cases that you see as a psychiatrist, and what are the symptoms that you see, Doctor? Yes, welcome.
Hello, thank you for the introduction. Nice words about me. We're all facing a pandemic now, which doesn't discriminate male or female, rich or poor, educated or uneducated, east or west, nothing. But anyone. So this is causing an extraordinary stressful situation. So this is something. It is not in what is happening, how you perceive it and deal with it. So it varies from person to person. Uh, Many suffered from mild transient symptoms. We have a lot of major psychiatric illnesses too. The importance of stress is it reduces capacity to fight an illness. That is the mind-body connection. So common issues we face were fear. Fear of getting the infection to self or family. In countries, children are grown up and they have gone out to different fear of isolation, quarantine, admission, ventilator, all those fears. Then the second thing was losses. Many lost the job, was financial crisis and loss of near and dear. Stigma, because people thought this disease can spread like anything. Even doctors were made to vacate their house just because they were working in now. Then, see, human beings, once they are satisfied with their physiological needs, hunger, thirst, sex, etc., they go for safety needs. That is also finished. Then for social needs, need for belonging, need for intimacy, family, friends, mainly affected in COVID situation. And people had severe, people manifested in different ways. Acute stress disorder, like we had a patient, a churchgoer, a middle-aged woman. She was brought in a very agitated state. She was tied up and listeners, uh, church and other places are closed, and she thought she's doing it and she will be punished. So acute stress disorder can be managed in 2 to 3 days and they follow up for coping skills. Then, because of the ongoing stressor, they can something called disorder, which can manifest with anxiety or depression or difficulty in other ways. And PTSD is also a common factor, especially people with ventilators. They can get later on flashbacks, reliving, and extreme. These are the stress related. Then another problem we faced was increased substance abuse, alcohol, drugs, internet usage, even to the levels. And many had major psychiatric illnesses. This we are talking about normal people. how the stress is manifested. Highly restless, irritable, anger outburst, aggression. If it is turned to self, it is self-harm. If it is turned to others, it can be violence. Domestic violence increased, breakups were more, and divorce rates, we are yet to get it. Definitely it is going to be high. Then disturbances in sleep and appetite. See, usually it is reduced, but there were cases when both were increased. Comfort foods, no? Food is used as a stress buster by many, and especially junk food. This led to uncontrolled diabetes and obesity and other health related issues. Emotional symptoms, crying all the time, withdrawn, sitting in one corner, not interested in household activities, not playing with the children, not attending phone calls, not even watching TV or news. And this developed into a feeling of hopelessness, helplessness. What is the use of me? That is worthlessness, and even suicidal ideas and attempts. People also complained of memory forgetfulness, lack of concentration, especially students, lack of concentration and memory. Then multiple aches and pains. Tension headache rates were very much increased. So these were the things happening for normal people. Now let us see what was happening to mentally ill people. Many relapsed because no follow up. See, lockdown, they couldn't reach the doctors, and it is tough to get psychiatric medicines without a prescription. And many lost the job, so there was no money to buy the medicine. On top of it, all the stress in family was displaced on the psychiatric patients and also children, like Dr. Deepa was telling. Then certain cases like OCD, obsessive compulsive disorder, where there is a fear of contamination increased because already they are washing 10 to 15 times. We had a patient who used to count 100. He has to wash his hands 100 times. If it is the cycle is broken, he will repeat from the beginning. And suspiciousness increased to the level from anxiety to the level of paranoid illness. Depression worsened, and pre existing anxiety disorders like panic, phobia, all increased. So, relapse rate was high. It was an added burden for us and for the family. Now, suicides were increased, attempts and completed suicide. The major factor we have to consider is pre-existing mental or physical illness. Physical illnesses like Dr. Aravind was telling, cancers, terminal illnesses like kidney failures. So the issue is they don't want to survive the thing, and monetary issues also. Then especially if there is lack of support system, the family, friends, no one is there to support, and you are living alone. And especially in old age, single people like a spouse is gone, their chance for suicidal ideation was high. If they are using alcohol in a very high level, under intoxication, they can attempt suicide. Here I would like to talk about some myths about what public and even some doctors are believing. That is, one is, if you are talking about suicide, you are not going to attempt. This is totally wrong. The talking itself means it's a cry for help. They are seeking help from you, especially in other specialty doctors and public. So look for this sign. Second thing is, once attempted, they won't repeat. Repeaters are high. Third thing is, by asking about suicidal ideation, are you instilling the ideas? Wrong. You have to ask because they feel understood. So these three myths should be removed from the society. If the family history had a positive suicide thing, it can increase.
So that was a great description, doctor. Our next question is looking at the vulnerable categories. The moment we had the pandemic come in, women were considered as the vulnerable category. So any specific symptoms, any gender specific effects that you could elaborate on for us so that we'll have a better idea of that,
Yeah,
please?
that is good because I am also a woman, but why we don't have gender bias? Okay, women are already having multiple roles and they are multitasking too. Now there is extra work. So many people sitting at home and maids are not coming. Then added to that, they have to work from home also. If the lady is seen at home, it is considered that she is at home on leave. It is not like that. She's working also. Then she has to take care of children, take care of their online classes. Then elderly people who are panicky about the disorders, their extra diet. Money is less. She has to run the family with that limited money. And one lady told me, please send my husband to some place, at least a park, 9 to 5. Because that man was going to the kitchen and asking what you're cooking, how can I help you, what you are adding. So this is added stress for the women. What is happening is they are losing their me time, the space and time. They had time for themselves to sit and relax once everybody goes to work, chat with their friends, go out for shopping, socialization, walking, park, something like that they would used to do. So be careful. Just they have to take breaks and spend at least 30 minutes for themselves and do whatever they want. They have to tell the family, I have to take care of my mental health also. And pregnancy, there was more because they were so anxious about the child. Even we do not know we have to wait and see what are the complications COVID can cause for children. I mean, pregnancy. Now, coming to elderly people, they are already having comorbid diseases like diabetes, hypertension. They are their mobility is totally gone. It is no socialization, no walking, no meeting friends, nothing like satsang, bhajan, or they were even going to places of worship. That is also closed. So one old man told me, doctor, it's like I'm condemned to death. I'm waiting for death, and media is hyping. All old people they are going to be at higher risk. How much they are hyping, and the anxiety is directly transferred into their fear, their anxiety, sleep is disturbed, depression is high. And another group is children and adolescents. Children, Dr. Deepa has beautifully told about maintaining the routine. Few points I'll add. You have to explain to the child. Just telling them you wash your hand, you sanitize, you wear mask, child is confused. And why she's not going to the school also has to be explained. Then, uh, just don't transfer your anxiety to the child. Just displacement. Child is going to be more panicky. And some kids were found to be regressive, like they went back to their original development stage, like stammering, nail biting, thumb sucking, bed wetting, temper tantrums. Parents should understand that this is a temporary phase and stress is manifested like that. Some children had a severe aggressive behavior also. So parents need more counseling because child is a biopsy of the family. Then adolescents, one point I want to say, high energy stage, they were managing with physical activities like sports, gym, swimming, dancing extra. Now everything stopped. So they may seek for alternate pleasure like drugs, alcohol, smoking, internet, video game addictions, and even porn addiction was increased. So, hello, Sapnesh.
Yes, doctor. Yes, doctor.
Now, do you have any questions further?
Okay, so
Yeah,
we'll
we have.
the best ways of what are the best ways of dealing with some of these issues, doctor? I think you've given us a
Yes.
brief. Are there any specific other
Yes.
tips we can take from the show?
Yeah, I would like to start with what you should not do. That is don'ts. Okay, let us talk about do's later. Avoid too much TV news, too much exposure to COVID news, TV channels, discussion about COVID. Reduce coffee, tea intake. They are stimulants and they are addictive also. Don't turn into smoking, alcohol, or drugs as a stress buster. Don't take unhealthy food, like especially if it is you are buying from outside and eating. And please don't have a negative attitude. I had a friend in our group, only that lady used to say, I know I am going to get it, I am always getting all the infections, I am going to get all complications. And she is the only one who suffered maximum. All of us were exposed. Then let us talk about some do's. I'll say 4 A's. Avoid that government is already telling you do all those masking and these things. Then alter the situation if possible, like working from home. And if vaccine is coming, we can modify. If these two are not possible, accept. Whatever you resist is going to persist. So accept the situation. It's okay. There is a pandemic. All are at risk. That doesn't mean I am going to catch it. Even if I am going to catch it, I may not have major symptoms. Many are just surviving without any even hospitalization. Even if you are hospitalized, you need not die. So such positive self-talk. Then you have adequate sleep, healthy diet, exercise regularly. You can do exercise at home also, like yoga, spot jogging, put on some music and dance. Your endorphins will be released. You feel high immediately. Then watch humorous things. Turn, take up all your hobbies. Your bucket list will be there, no? What all you wanted to do. Make a list of people you wanted to call up. Like quarantine period, you are bored. So call up one by one. Please don't discuss about COVID. Even if they start discussing, turn into something else. Then, if you are trained, do yoga, meditation, and pranayama. See, if you may not be knowing what is pranayama, what I suggest is do focus breathing every 2 to 3 hours. Keep a reminder, take a break, and 3 to 4 minutes of just close your eyes, take a deep breath, focus on that, have a pause, take it, breathe it out, then again pause. This will help you to distract from all this worrying thoughts. And in psychology actually, we advise relaxation techniques like JPMR is there, which is downloadable from online. That is Jacobson's progressive muscle relaxation technique. So I'll tell you in short some take-home tips. It's okay not to feel okay. This is a time where we are supposed to feel sad, anger, angry, or depressed. So accept it. We are also human beings. You know your limits. Cry if you want to cry, and do positive self-talking. Take it as an opportunity to learn something new, accept unavoidable situations, grow spiritually. And one thing I'll tell you, keep evening, for example, I keep it as whenever you are having a worry, tell, now I am not going to worry about, I'll deal with it at 6 to 7. Okay, so you postpone worrying, and by that time it will be over, or you are in a relaxed mood to deal with it. And seek help when you are overwhelmed.
Thank you so much, Doctor. That was brilliant. And it's important to note that Dr. Preeti Gopinath has written several papers on stress even prior to COVID, and has, in fact, done some research on stress medical students actually face as well. So thank you, Doctor, for that wonderful explanation. Let's quickly move on to the Q&A. I think we are short of time, but we'll try and answer a few questions. I'll kickstart the Q&A with a question that was posted to us prior in private, and this question is to Dr. Aravind. Meanwhile, the others can post their questions if they have any to the specific doctor on the chat window. So my first question is to Dr. Aravind, and the question is from a person who is anonymous. My mother was treated for breast cancer, and now she's on hormonal therapy. Is it safe to continue medicines and medication during the pandemic?
Can you hear me now?
Yes, please.
Yeah, that's a good question, Samesh. See, after the treatment for breast cancer, those patients who are hormone positive, we prescribe them hormonal therapy, that is usually for a period of 5 years. If they are premenopausal, we give them tamoxifen, and if it is postmenopausal, we give them aromatase inhibitors called letrozole. So during this COVID pandemic, it's safe to continue this hormone therapy. This is not immunosuppressive therapy. So it is very safe to continue with your hormone therapy, because the benefit you are getting from this hormone therapy is on the higher side when you weigh the risk actually. Because the benefit is to increase the recurrence of the breast cancer on the opposite breast or elsewhere in the body. Definitely, the patients are advised to continue with their hormone therapy. But one more thing is that you may be asked to visit a hospital to collect the medicine after 3 months or 4 months. So during the COVID pandemic, I can advise you can just make a call to your doctor and tell that this being a COVID, should I travel now? Then your doctor will ask you whether you have some symptoms or not. Then if you are asymptomatic with cancer, there is no need to visit the hospital. You can continue the same medicine which is already advised. So it's very safe to continue with the hormonal therapy. No problem.
So thank you, doctor. So you're actually recommending the continual of the treatment at this
Yes,
moment.
definitely.
Yes.
Yes, definitely.
Yes. Thank you. The next question is for the pediatrician, Dr. Deepa. The question is that now that we are approaching the flu season in some of the states in the country, and that there are possible other infections along with COVID, what are the precautions parents can take to make sure that their children are relatively safe during this COVID pandemic time from other infections?
Yeah. So, flu can be prevented by a vaccine. So, what I would say is encourage everybody to go and get their children vaccinated. So, that will prevent the flu to a great extent. So, that is one way. The other infection that we see during the season is a dengue fever. So that again is going to become a little challenging when we face a child with fever, especially with a rash, whether it's dengue or not. Again, dengue fever can be prevented. There are a lot of measures that can be taken, especially the virus, the mosquito that causes dengue fever grows in clean water. So storage of water should be done very, very carefully. Flower pots, when they keep a plate around the flower pot where there is clean water stagnating there, that should be prevented. So if at all you're collecting water and keeping it in drums, it should be kept closed. Try to prevent mosquito bites by keeping your children covered throughout the day, especially during early evenings, and especially when you take them outside, to keep them fully covered, and try to use mosquito nets. So these are the things that can be done to prevent that. Flu is much easier because right now we have very good flu vaccines which do protect our children. So I would advise everybody to go and get their flu vaccines done. Yes.
Thank you, doctor. Are there any other frequently asked questions, doctor, regarding children that have come up on our chat window? Were you able to spot any that you think you would like to answer?
Yeah, I think someone was asking about how homeschooling will affect the child, how a child will get affected. Yeah, homeschooling is definitely going to have an impact. I mean, online classes and homeschooling is definitely going to have an impact on children because basically all children are not very they're not well versed with technology. Parents sometimes are not able to help them, and definitely a parent is not going to be able to take the place of 7 to 8 teachers. So in the school, 7 to 8 teachers are helping this child to learn something, and here the single parent has to sit and try to figure out and help the child. Distractions are more when the child is in school, and most importantly, the child is unable to meet with friends. There is no structured routine to their life. So there is definitely going to be an impact. And above all, that we are extremely concerned about is screen time. So screen time is an absolute no-no. So all these years we were telling parents, don't give the phone, don't give the iPad, don't give the laptop to any children, don't allow them to sit and watch this, that. But now the same, we have to tell the parents, okay, allow your children, to do it because all their classes are going on through that. And the worst is many children do not have access to this. So they are finding, I'm having children coming to me with all kinds of vague symptoms, and physically I don't find anything wrong with them. And then finally, when you kind of call them and talk to them alone, the challenge is with their studies. They are unable to cope. They are not able to understand what the teacher is telling them. Their parents are not educated enough to be able to help them. So that is what, especially children in higher classes, are definitely finding it challenging. So it is definitely a challenge that children are going to face in the coming days. And hopefully this will not be forever and it will only be a short time and we will be able to get back to normal soon.
Let's hope, doctor. Thank you so much for that. Our next question is for the psychiatrist, again, Dr. Preeti madam. So the question is, now that a lot of people are working from home, and there is no such concept as office for a lot of people that were working in corporate companies and MNCs. What are the things that, doctor, you would suggest to them considering that earlier they had office hours and now there is no such thing as office hours, and they work through the day, sometimes across the night. So what are the things that doctor, you would suggest or recommend to these people so that they can reduce the stress due to work from home?
Yeah. Actually, this is a complaint many are talking about, because when they were going to office, they had limited times. Now they are working all the time. There is like, it's like no breaks. So I am telling them, you follow your routine. Whatever you were doing, stick to that. And when you were exercising, please do exercise. Don't postpone. And when you are taking breaks, please do take breaks. And socialize over phone. You can make video calls and get support system. This is called emotional sharing. You're supposed to share your worries, anxieties with friends and family, because you're not meeting them, you may not know what is happening. So whatever you were following before, you continue with added uh, breathing exercise like pranayama, relaxation techniques I have already told you, you can do online also, and compulsory taking emotional support from others. If you are a spiritual person, it is easier. That is what they are doing. They just surrender and they transfer the worries to the higher force and accept it. Just accept this is happening. But at the same time, they have to act. It is not like somebody will take care. It's not like that. Even if you are losing the job, try to find out something which is possible to do from home and keep yourself that routine going. And if you are overwhelmed, you can't manage the stress, seek help. For example, I was planning to tell you when to seek help, like sleep disturbances, you can't sleep, or you are getting up often, or you're getting up early morning, you don't feel refreshed at all, then you have suicidal ideas or attempts are there, and are becoming extremely angry or distressed, or you're finding some abnormal behaviors in yourself or in your friend, please help. Especially if you're losing your personal care, hygiene, and you feel like dying, all those things.
So doctor, I assume that these are the symptoms that people should look out for when they want to reach out for help,
Yeah.
uh,
Yes.
whether it is from the medical side or from the family.
Yeah.
Yes, thank you, doctor. We have one more question to um, our oncologist, Dr. Aravind, and the question is, uh, one of the relatives of a friend has undergone treatment for colon cancer and has been cured. Is there a higher probability of this person getting COVID in comparison to a normal person?
So this particular patient have completed the treatment. It's an early stage and completed the treatment. If the patient is not having any other comorbid condition, the chance for developing COVID is same as that of the normal population. It's not on the highest side. Cancer per se is not a risk factor. If the patient had a recent treatment with chemotherapy or with radiation treatment, which I have already mentioned, then it is a risk factor. But this particular patient has completed the treatment years back, that is 2 years back. So it is not a risk.
Okay, thank you, doctor. And one last question, and this question is to Dr. Deepa, and the question is, how will COVID impact children with autoimmune disease?
Uh, Actually, we do not have too much of data to definitely say how it will impact. But the problem is not the autoimmune disease per se that can cause problems. It's more often the medications that these children are put on. Most children with autoimmune conditions are usually on steroids, and children on steroids are prone to get, they can, because basically that's an immunosuppressive drug, so it suppresses the immune system. So those children, when they are exposed to COVID, they can get a very severe infection. But uh, autoimmune per se causing what it does with COVID, the data is very minimal, because we do not have enough data to definitely say that something is, this is what is going to happen.
Thank you, doctor. I think that was very informative. So with that, I think we come to the end of the show. We've had three great speakers come and give us their best time and their best advice. Before we close, a few things. The first one is we've opened a new YouTube channel, and the link to the full replay of the previous episode is being shared on the chat window. So please watch, like, share, and subscribe to the channel. And a sincere vote of thanks to all our speakers who've taken time out of their precious schedule to come and address us during this time. And a lot of them were actually, quite busy, and difficult. It was difficult to contact them because they were at work. Unlike some of us who work from home, uh, these people from the healthcare seem to have additional work now in comparison to what they had in the past. So, a huge salute to all the healthcare workers, the doctors, the nurses, everybody who's involved in the healthcare system, and people who've contributed to our healthcare being what it is today and maintaining us. So, a huge tribute to all the soldiers as well, and the people who've laid down their lives for the country. Considering tomorrow's Independence Day, I'd like to wish everybody a happy Independence Day as well on the show, because it's a proud moment for us as well, tomorrow, August 15th. And I think it's a great opportunity for us to salute everybody who has worked tirelessly to keep this system going and to keep people healthy even during this time. So, thank you so much for joining us. Thank you so much for being with us and being patient with us. Thank you, doctors, once again. And once again, I'd like to thank everybody in the audience, and we hope to see you in the next episode. Thank you so much. See you soon.